Let me first start, if I could, Ellie, to ask you a question, and one that I think is particularly important. When you think about, there are many, and I've gone through this for decades with some of our, top research coordinators, and I asked them, I said, where do we find a high quality research coordinator? And they've often said to me, there is no specific training program that one goes to become a research program. Can you tell me a little bit about how it is that you became a research coordinator and what were the skills you needed to acquire to do so?
Well, I think maybe my story is kind of an illustration of how you never know where you find your research coordinator, because before I became a research coordinator, I did no clinical research at all. I was working in the lab and trying to make cartilage cells. So for me, I just decided that I wanted to do something different and something that was more, would result in more patient relevant results. So yeah, I kind of accidentally ran into a vacancy for a research coordinator at my hospital. So I think it's difficult to really say what do you need.
But your path was one where you were in the sciences, so you had some content knowledge in science, but it was in the fundamental sciences. Let me ask for some of the others. I know there's some other coordinators right now who are on the line here. What was your journey? Like, maybe we can share that, because I think there's going to be people who are, this is a small group, and it's purposely a small group because we're going to be having a discussion, but it's going to be, posted to many others who will probably be looking here for two reasons. One is, I'm trying to conduct research and I'd like to work with someone. I'd like to understand what coordinators help me with. There's going to be many people who are probably in their career thinking, oh, I really kind of like that job. I like what you said. How do I get it? How do I become one?
I think if I can make an addition, if I look at the other research coordinators in our hospital, so we have a few departments who have their own research coordinator. I think it's mainly nurses that kind of somewhere along the way started to be involved in a study, and it kind of expanded, and then they became a research nurse or a research coordinator. So I think that in what I see around me, that's a common way.
Kim, did you want to say something? Or I see others. I see Miriam. I see Victoria. I see Ahmed. I see a lot of people here who probably have lots of things to share. So I'll start with you, Kim.
Okay, so Mo knows my story because it started with him. I thought I was going to be an emergency physician for the longest time. I wanted to be a doctor. So I was in a co-op program in undergrad. It was like a pre-med program. And I was like, doctor, that's all the careers that I can think of. And then I worked with 8 months on a co-op term with Mo. And I was like, whatever, I'll just do some research. It'll be good for my CV. And I loved it. I loved it so much. The writing the papers, the communicating with people from around the world, actually contributing to something big and cool and developing this new knowledge. It just hooked me and I never left. I had sort of a direct path, I guess. And then I just did the health research methodology program at McMaster and got a bit more methodological knowledge and sort of moved to a more senior position. So that's how I got there. But I've actually recently hired someone. I'm the research manager at St. Joe's now, and we didn't have a research coordinator, so I needed to hire someone so we could do our studies. So I didn't quite know what I was doing at first, but I put a lot of thought into the skills that I wanted someone to have. And I was really looking for someone, first of all, who had a basic understanding of what research is. So some previous research involvement is really helpful, and I was looking for that. It didn't have to be like a decade or anything like that, just like being involved in some studies. That's helpful, just so you know what research is and what it involves. And then communication is one of the things. Communication is, if you look at Ellie's list of things that she does in a day, it's like 90% communication, whether it's, talking to the pharmacist or convincing a patient that this study, that might be right for them. or calling patients to convince them to do one of the follow-up visits or whatever. It's all about communication. And then the other thing is organization and time management, those sorts of skills, which it's kind of hard to teach that. And it's also hard to evaluate whether someone is good at that. So that's a difficult one. But I think if you have communication and organization, those are the two main things that a research coordinator needs. And everything else can be learned.
Interesting. And any other perspectives?
Well, I would like to add one more thing.
Sure.
I think that for a research coordinator, it's very important also to be a people person, I mean, it's kind of related to communication, but it's also important you have to like people because you're surrounded, and also having empathy, because 90% of the clinical trials, so you also have healthy volunteers, but you also have patients. And sometimes it's not just, for example, a hip fracture. Sometimes it's a more serious disease that you are doing research on. And it's important sometimes to have empathy and, that kind of, social skills maybe.
Yeah, I think that's coming along a lot, actually, to see that. Yeah. Any other, yes, Victoria.
So my career in research is definitely still ongoing, but kind of how I got into it, I did in my undergrad like a lab-based thesis. So I was working in a lab, working with cell cultures a lot, and that was just not for me. I was very repetitive and I liked working with people. So I had like an internship in the summer at Sick Kids where I was working on a clinical trial and really enjoyed that. And then I did a 1-year master's in a global health program that was more about like research methods and again, just like international collaboration and working with lots of different people and patients more so. So then that kind of just stimulated my interest and got this job afterwards, and still learning.
Very good, very good, very good. I'm going to jump to Ido. I see Ido thinking. Ido, you're thinking very, very deeply right now. So I'm going to ask your impression of this. So when you're from your perspective of starting as a faculty back home, done a fellowship, you're starting as a faculty. There are pressures for you to be, to take on research. What was your thinking point? What to you has been the greatest value in working with, a strong team, or at least a strong research coordinator at a minimum?
Thank you, Mo. What I think is very important if you work with a research coordinator, she must be complementary to the clinician. If I look at Ellie, she's a totally different person than I am, and that's what makes us a great team. For me, I've been at McMaster for 2 years. I've been looking around. I tried to copy as much as possible. I had all the opportunities which you made for me, but when I came back home, what you say, you need a team, you need enthusiastic people, and within 5 years, we have a team of about 10 people working on a daily basis, and there are many nurses who want to do a little bit more, and they just work for a couple of hours a day on research. And if you have a team like that, all together, all enthusiastic, who all want to do their thing and are complementary, then it's just fun. Then it gives you a lot of energy. And I can tell you, Ellie is at that moment on maternity leave. She just has a great new son. And it's a hard time for me. It's a very hard time for me. I have somebody else to replace her for a couple of weeks. But it's in these days, she's not there. A lot of work for me, but also a lot of energy from the team we are missing. So that's
that's a very powerful statement, and that it is a team. I think we sometimes forget that research isn't a silo, and I think we all know those people. We all know those groups that are siloed, and they sadly hit a plateau very quickly. And unfortunately, the best members of the team realize that very quickly, and then they defect to other groups where they see that. So part of the challenge, I think, for a team is to stay relevant and stay respectful of each other's roles. Let me ask you this. from a point of view of a research coordinator, when do you feel things go wrong? Like, in other words, what are some of the red flags in a research like as a research coordinator, you walk into a program, what would be red flags for you that would suggest these are potential problems that aren't going to lead to success? And you can speak to it about the culture of the team. You can speak to it about leadership. You can speak to it about workflow, because oftentimes when they're on the other side, people don't understand why they can't hire someone or why people won't work with them. They don't sometimes have the insight. So maybe we have a very strong group of coordinators here today. I'm wondering what your experiences are. You can speak hypothetically. It's more just what would you see as being clear red flags that would be leading to a dysfunctional team?
Yeah, what I think some people already said that is you must know how to communicate, because research coordinators, they're communicating whole day. Clinicians, there are hard people to work with. So don't get a fight with the clinician as a research coordinator. You have to add all these people together. So if you have somebody working with you who's looking for fights, is not communicating in the way you want it, then you get the problems.
Okay,
is that what you mean? Or
no, that's good. So that's actually good to get your side of it. Now I want you to mute, and I want to hear the side of the coordinator, Ido.
Oh, sorry.
No, it's good. No, it's very good. It's very good. So I want to hear from somebody else who says, okay, now here's my side. Now here's when things are red flags. So what are red flags? Either Ellie, Kim, Victoria, Miriam, Neha, anyone.
Before Ido spoke, I was actually going to say communication as well. Every time I've seen something go wrong, it's always because one party stops communicating, whether it's the coordinator, whether it's the method center or the site or the PI or anyone. If someone stops communicating or is not communicating effectively, things just break apart. We don't know what the status of things are. Like, maybe something's moving, maybe it's not, maybe there are problems, maybe everything's going great. We just don't know. So that's when all things break down all the time.
I think
Victoria. Okay, sorry. Ahmed, then Victoria. Go ahead, Ahmed. Ahmed, yes.
Right. Yeah. I was just gonna say, I think also one very important thing is defined rules. So, like if you define rule every member of the team, that will make it easier. Again, like to communicate and make sure you know what you need to do and what you need to follow up on. So I think it's lack of defining rule. I think it could be a major issue in a research team.
Victoria?
Yeah, kind of just what Ahmed was saying. Like we discussed the other day about making sure we have like patients enrolled and not missing any patients in a trial. And I think that is like a collaboration and defining the roles. Like the research coordinator needs to be aware of who's coming into clinic, and then let the PI know that they're eligible, or the PI needs to let the research coordinator know that there is someone eligible coming up, and just to keep an eye on any clinic appointments or when their surgery is. So yeah, I definitely agree with both of you, just like defined roles and then the communication that has to occur because of that.
That's very helpful. Anyone else want to comment?
Yeah, I think being clear on expectations as well is super necessary for, if you've got a large lab and you've got multiple research assistants, coordinators, research associates, sometimes not knowing what each person's role and their expectations are is difficult. And then, like everyone has said, keeping those doors of communication, especially email, extremely open and clear and concise. Like, I can't tell you how many times I was like, the PI said to me, "Oh, I thought you were going to be doing this." I'm like, "Well, you didn't say that I was supposed to be doing that."
Right.
And it also comes down to, PI leadership skills, right? So like some are micromanagers, some are very hands off. And I think that's a give and take in the relationship where you have to kind of get to know each other and figure out where those strengths and weaknesses are.
Yeah, I think you're right. I think what Ido had said earlier too, right, is that you are not just getting involved in a program, you're getting involved with people in that program. So, the reality is you can love the group, but not get along or not just be connected with the people in the group. And that's not going to be successful, I think. Mm-hmm. You can love the people in the group, but just not be inspired by the research. And unfortunately, that's not going to be helpful, right? So it's kind of that really tricky mix of finding the right fit, I think anyways, and finding something that, allows you to feel you can grow. How important for you as a research coordinator is is the ability to grow within the role, right? Because there are many, many careers where you end in, and then that's what you do, and you just go straight across. And and again, it comes back to personal mindsets. But how important is it generally in the role of research coordination to be able to see growth?
I think it's very important. Like it's if you stay at one level for a long time, I think, and repeating what I would do, so I think it would be a little boring for me. So I would love to learn new things, like use new tools, and use different skills, and also work with different teams. That will definitely add to my career and add to my learning skills.
Yeah, I think this is very specific to where that person is within their life stage. So I can think of some of the coordinators that I've worked with that are retired nurses, and that's where they want to stay, and they've very explicitly said that. I think that's, again, when you have a really strong leadership individual who's having this conversation with you and saying, like, okay, this is where you are. Is this where you want to be in 2 years or 3 years? What are your career aspirations? And then meeting that person where they want to be.
Yeah, I can totally understand that, and I can see that. When you start out, though, and and maybe you can, and I know there's a number of coordinators who are more senior here as well, but I think there's some earlier career ones as well, I think. And I know, Ellie, you gave your breakdown of your day, but what's, like, if someone's saying, listen, I like that part of it, but I don't like that part of it. Don't be a coordinator if you don't like what, because there's going to be something you have to do a lot more than other things. So I know there's the writing part, there's the writing manuscripts, doing data analysis. That some coordinators do it all, and some that are in big groups have a data scientist or someone else who will do that part of it. So what are some of the things that you would recommend? You gave a very clear list of all the things you have to do, but like orthopedics, right? You say, okay, it's great and shiny when you first see it, and then you get into the call and you get into all this other stuff, and you realize, oh, there's a lot of stuff that's just work. The clinics are work. If you don't like that, it's going to be a problem for you because you have to do that. So what would be some of those things that people should have an awareness of when they're thinking about a career in this area?
I think for me, that's also related to the previous question about development. So when I first started, there was a lot of, I would say boring work of filling out CRFs, for example. That's not something I enjoy very much. It's kind of the boring part that needs to be done. But for us, doing that, like participating in the large multinational trials, they also opened the opportunity, for the hospital to hire me, for example, but also to set up our own studies. So I think that's then the challenge that you kind of work for from the beginning. So you kind of have to make a foundation where you can build further on. So now we are more into setting up our own studies. So I'm involved in writing the protocols, also do the data analysis in the end. So I think you kind of have to make an investment with the work you don't like to do to be able to do other things. I think that would be the same in any job. You always have to do some work that you don't like to do. So I think it would be a shame to kind of be stopped from being a research coordinator just because you don't like to fill out CRFs, for example. As long as you know that you can kind of make the combination of tasks in the end.
Yeah, I mean, I think I get your point, which is, there's going to be parts of the job, and just to put it clearly, what you find difficult, I imagine there's others who actually quite enjoy interacting. Like, I'm not saying it's all great, but there may be parts of the things that you don't like that other people like, and it's that individualization issue that you can't always predict who likes what. But it is interesting to me because, I don't know, at the end of the day, you want to be able to put people, the best thing about a great team I've learned is put the right people with the right skills in the right spot at the right time. That's it. So we all know sometimes, and you know yourself sometimes, like, I'm doing this, but I'm pretty sure what that person's doing, I'd like to be doing. And I bet you if I did that, I would be really good at it. And we should figure out a way, but we sometimes wait too long, to make those decisions. And quite frankly, sometimes the coordinators will say, trust me, I can do that. And then the people who are making decisions they're blind, they're not seeing it. So those are things I think that have to happen, right? When you get open communication, you all said it, open communication. But the biggest challenges I think are getting people to align their skills with their passion. And when that happens, it's, great things happen usually. How much for all of you is writing a part of your day-to-day life? Like whether it's preparing, writing papers even, or drafts of papers, is that something that some of you are doing? Or is it more protocol assistant work, or is that highly variable depending on who you're working with?
For me, it's almost my entire job is writing, whether it's writing emails to people or writing protocols or writing, regulatory documents or anything like that. My job is almost all writing, but I don't go to clinic and see patients. So I know there's some people who do a lot of verbal communication, but my job is mostly writing. I think there's such a huge diversity of things that coordinators do that I think the answer to this question will vary between groups.
Yeah, absolutely. But I'm just trying to I'm just getting a sense across the group here, just for trying to understand it. So Victoria, you were going to say something.
Yeah, I think it also ties into like the development, like throughout the job as well. Like I know when I first started, it was a lot more of like clinic work and like completing CRFs and more just like data validation. But now, especially just as I've like understood things better and gotten a little bit more like freedom and just even communication with like other research coordinators and like the PI, I've like worked on my own sub-studies or like been responsible for writing manuscript for the other studies that we're doing as well. So I think like, writing is a lot more now, but it has definitely changed as I've worked.
Interesting. Miriam, I'm going to ask you a question. You've seen coordination of research and research through a different lens, because, you were in Spain doing quite a bit and then you moved. So what was like shifting teams? What was that experience like? And what can you share about sort of that experience of knowing one group and how one group works and then transitioning to a different way of working? I suspect it was different.
Yeah, it was different because even though before moving to Canada, I thought that Spain and Canada were kind of the same culturally, they are not. So the way the staff, the way they communicate is different. Maybe in Spain, I could be more direct. And so here I learned how to say something in a different way. So this is important, because I remember when I start here, I thought I had the feeling like the communication is not quite the same. And then I learned that it was like, it wasn't the language, it was like the way people here communicate between each other. But I think that as long as the staff, not only the research coordinator and the PI, the other clinical, the other clinical staff in the hospital, nurses, or if you have PhD students or postdocs, the whole group has to be honest and communicate between them. So I don't know, like, I feel like it was different. I remember the first time was kind of, okay, this is going to be hard. But then once you get to know people, right? It's like a family. Everyone is different. Everyone likes one thing, doesn't like the other things. The PI in Canada is different. The PI in Netherlands, maybe,
Yeah, right.
And you get to know people. And then once you know that person, then I believe that you can build a relationship, and it's not that hard.
Right. That's very good. Are any of you thinking, I know, I don't know everyone here, but is anyone thinking of transitioning into a role of doing research more seriously than not, or different role? Well, I don't know. I know some coordinators here, and I know Yiping already transitioned. Yiping's doing data science work, mostly writing, I think so.
Hi, everyone. Thank you, Tim and Ellie. And I learned a lot. That's very interesting lecture. And I'm not considering transition. I like my current job, but I am very interested to know what's the next stage for research coordinators, or most likely your colleagues or yourselves. What will you do next? I know, like Ahmed, you have got a very excellent position, and I think it's so appropriate for you. But what would you think, or in your observation, what do you see people will choose their future career based on the research method, research coordinator
experience? Okay, so maybe, yeah, okay, Yaping. I mean, since you named Ahmed, maybe you could speak a little bit about sort of, what your transition has been like and where you are now.
All right. Yeah. So I start my career. I did my medical training in internationally in Egypt, my own country. And then I was always fascinated with McMaster and then being the home of evidence-based medicine. So I moved to Canada. I did master and PhD in McMaster, and I had really a good run. I learned a lot about my research methodology and statistics. So after finishing my PhD, now I'm in Alberta. So I'm at University of Alberta. I'm a postdoctoral fellow here. Yeah, so I'm trying to learn more. I'm getting more involved in statistics and data synthesis methodology. So I'm learning more about the network meta-analysis and systematic review methods. That's really kind of my passion right now. So I'm going towards this side of research. I'm still interested in trying to get back to medical practice here in Canada, but in the meanwhile, I'm really enjoying all the research methodology and statistics I'm learning now. And yeah, recently I've been involved in some COVID-19 work, and again, like data synthesis and how we can do better rehabilitation for the whole community after COVID-19 pandemic.
Oh, very good. Thank you.
No problem.
Oh yeah, Neha, yes.
Thanks for the talk. I really enjoyed the talk and learned a lot from this. I'm the one who is not a research coordinator, but I am eagerly looking forward for some position like this. So my question for you all as a research coordinator, I'm just wondering, I am a physiotherapist from India, and like I've done bachelor's, master's from there. I did my PhD in rehab from McMaster, and then I do have a postdoctoral like from Laken. But right now, like I'm wondering, I'm applying for jobs like anything for research coordinator, but not even single call I get for getting involved in research coordinator position. So I just wonder, do I need any specific certification like ACRP, or should I join another master's in epidemiology or biostats? Like, I'm not sure like where I'm lacking. Like, if you could guide me with that, I would really appreciate. Like, I'm looking forward to get involved in sort of like multi-center trials. Like I have been involved in a like pilot study, systematic review, or meta-analysis, or like single center trial, but not like having that expertise of getting involved in multi-center trial. Like I do review your profile, Kim, and even Ellie. Like I feel like I want to be somewhere like there, but I don't know like how that could be possible. So if you could advise me or give me a little guidance, I would really appreciate that.
Well, sure. There's a thing in McMaster that's like an e-visor thing, and I actually review people's CVs and cover letters and everything for research coordinator positions. I'm happy to review your CV. Sometimes there's just something on there that people are like, and you may, I don't know, just weird things or things that you're not highlighting that you could be. So yeah, I think Abby can probably send you my email address if you want to do that. But there's not really an easy answer to this. It's a lot of being in the right place at the right time. Like maybe we were hiring for a research coordinator and it had a strong nutritional component to it. So I ended up hiring someone with a bachelor's degree in nutrition. Now she's moved on from that nutrition study since then, so it's no longer relevant, but she was a good coordinator, so we kept her on other studies. Sometimes it's just that one thing. Maybe there's like Ahmed's fit joints trial or something like that that's very strongly about rehabilitation. Maybe they're looking for someone who has that background. So yeah, I mean, there's the ACRP, CCRP, all that kind of stuff, but I have never really cared too much about that. It's very optional. No one in my team really has that. If you want to, it definitely does show that you have those skills and you have the regulatory knowledge and all that. I mean, if you want to go down that route, it's a little bit more expensive, but there's really, I can't really pinpoint one thing other than highlighting that you've been involved in research, you can communicate well, and you're organized.
Sure, I'll forward my CV if you can guide me how I can like edit it or format it to make it more visible for recruiters. I would really appreciate. Thanks so much.
Maybe someone else has. Ahmed, have you hired any people? Have you been involved in that?
Yeah, so when I was at that Jira Center in St. Peter, so we usually hire coordinators, but yeah, I'm not in that position anymore, but I can, so I can refer you to.
Yeah, I think the key thing is now stay connected in the group that you're interested in working with. So you stay connected in people who are doing clinical research, which is your interest, and multi-center trials, which is a smaller group, but it's still valuable to have. And I think opportunities come up here and there, right? So, but if you're top of mind, is always going to be someone who and people who they've had a chance to work with you, I think is always positive, right? Generally speaking. And so, just based on your CV, it's a strong CV. I mean, so I don't think to Ellie's point that you'd have to do more and more training. I think really what you want to do is connect with connect and do work with groups that are involved, however you can. I know you've been trying, so it's not that I know you're not trying. So, but just connect with groups, and that'll help. That'll help for sure.
Thank you.
Folks, I know that we could talk for another hour easily, but we're past the hour, and I want to be very respectful of everyone's time. For some of you, it's midday. Some of you, it's evening. And I want to take a point just to both thank Ellie and Kim. And quite frankly, this small group is really all of us, right? So we've been a panel discussing these issues. And I'll say it again, the reason that we purposefully made this a small group is because you all know, I suspect, pretty clearly that we would not have been able to have this sort of discussion in a webinar format. It just wouldn't have happened. It would have been Q&A and quite not anywhere near as in depth. So I've been very happy with this approach. As we've gone through, we only have 2 more of these sessions to do, and we're done. We've done 24 of these events in the last 4 days. And I think it's been the right thing to do given the current circumstances. So thank you all again for participating and making this a highly successful event.